Okay, can everybody see new to Medicare agent training part 2, Medicare Advantage plan comparison? Part 2 of 4. All right. Today, this is really designed for new agents. Zach, I know you're not new, but you might pick up some good stuff on this. Who knows?
Oh, he's going to get mad at you.
Why?
You called him
It's
Zach.
okay.
Did I just call him Zach? I meant Kyle. God. And I knew it was Kyle too. Why do I do that? Why do we call
It's fair. If we weren't family, it wouldn't be we got the same last name, so
Well, today we're going to talk about the understanding of different plan types, comparing benefits, and how to use plan comparison tools effectively. That's where Charlie's really going to come in. So let me get with mine. So I feel so silly doing this with y'all, but okay. What is a Medicare Advantage? Medicare Advantage MA plans, also known as Part C, are offered by private companies approved by Medicare. MA plans offer both MA only, which is Medicare Advantage without drug coverage, and MAPD, which includes drug coverage. These plans provide comprehensive coverage for both Part A, which is hospital, and Part B, which is medical. And remember, you cannot have both a Medigap policy and a MA plan simultaneously. I'm not really good with those big words. Medicare Advantage plans, MA only. Medicare Advantage plans are for someone who wants the benefits of MA for their healthcare needs, but does not need prescription drug coverage. Lisa, why would somebody not want prescription drug coverage?
They might be a veteran.
It might be a veteran. Yeah.
That would be one.
Kyle?
Perhaps somebody who has another option through employer health plan or something that way.
Yes, and the biggest one is when people are dodging the late enrollment penalty.
Yes. Yeah.
If a beneficiary joins a MA plan without drug coverage, they cannot add a standalone Part D plan. That gets very confusing for new agents because they feel like, well, we could do MA only, so they have all these rich benefits. As we know, the MA plans without Part D have richer, stronger benefits, but you can't have a PDP on top of an MA plan. In fact, if you enroll somebody in an MA plan and also enroll them in a Part D plan, the Part D plan will cancel out the MA enrollment. MAPD, Medicare Advantage prescription drug plans, offer comprehensive coverage for both medical and prescription drug benefits all in one plan. So when to sell MA only versus MAPD? MA only is great for people with tribal benefits, VA benefits, late enrollment penalty, or existing drug coverage. And MAPD is more comprehensive and it offers convenience by having it grouped together. Bundled, I guess. In healthcare, the experience of the patient is the new marketing. That is so true. And that's why we in the provider channel work really closely with our client hospitals and health systems, because the experience that this patient experiences with us is the best marketing tool we could ever have. I'm sure it was meant more in the care setting by the physician and nurses, but it's true for us as well. There are different types of Medicare Advantage plans. Medicare Advantage special needs plans for individuals with certain diseases, disabilities, and financial challenges. The one thing to remember, and we're going into it, which is chronic special needs. I get this question a lot. If somebody qualifies for a SNP, do they have to wait for annual enrollment period? Kyle, give us the answer.
Well, there's a CSNP enrollment period year round.
Yay, that is correct. HMO provides coverage from doctors, hospitals, and other healthcare providers in the plan's network, and a Medicare Advantage PFFS allows you to see any doctor who agrees to the plan's payment terms and rules. So the way when I describe it when I'm speaking to people is that a PPO, you can go in and out of network. It'll cost more if you're out of network, likely. And an HMO has a defined network that you cannot leave. Medicare Advantage PPO is a coordinated care plan that's generally more flexible than an HMO. Again, you can go in and out. It does cost more when you're out of network versus in network, but the PPO offers flexibility. Medicare Advantage dual eligible special needs plans are for dual eligible beneficiaries with Part A and B. How often can a dual eligible Lisa enroll in 2025 into a plan?
Once a month.
Yes, as long as they are enrolling into a
Um,
D-SNP plan, a true D-SNP, and integrated
and
hide
they're-
and FIDE. The medical savings account plans combines high deductible health plan with the health savings account. And that is my basics. And this is where Charlie's really going to dive in and probably what you came for, Kyle. So here we go. Plan comparison tools. Charlie, take it away.
Just a high level overview of the plan comparison tools and what they do. There are various tools available for comparing plans. These tools simplify the quoting process and enable you to gather all your information in one location. Some of those tools include Medicare.gov, MedicareOnDemand.com, which is our tool. And then there are tools provided by your upline. In our case, there's Sunfire, CSG, and other platforms. All of these programs have one thing in common. They help you as the agent determine which plans will work best for your client. Plan comparison tools use the information you input to compute the most favorable plans. They use the information that you input, such as prescription drugs, physicians, pharmacies, and the other needs that you put in, such as how often they visit the doctor, and what their pharmacy location. Oh, I've already put that in there. So just different information that you put in, it'll compute based on that. Plan comparison tools will compare costs such as premiums, copays, deductibles, and annual prescription costs. It will give you helpful plan information such as star ratings, MOOP, Part B give back, and expected annual costs. And then also it will give you usually the ability to fill out the scope of appointment, the ability to complete your enrollment applications on the tool, and then on some of the applications, it gives you the ability to migrate to and from your CRM.
Okay. So let's open it up for questions since this one didn't take very long. Does anybody have questions about the tools such as the CRM, quoting, enrolling, anything like that? The lead portal, any of our tools at all?
I do have a question. So I'm still using the IFG Sunfire. I haven't switched over yet to using the American Entitlements one. So when I do switch over there, is there a way to get like my previous client data migrated over to that one? So say this next enrollment period, when it comes around, my clients, doctors and medications, things like that will automatically be in there.
It does not migrate over. So now there's not a necessary need to move over to the American Entitlements version unless you're looking for a specific carrier that's not showing in IFG. I believe Devoted is one that doesn't show under IFG, but that does under American Entitlements. So unless there's a specific carrier that you're needing, it doesn't hurt to stay under IFG, but you can't migrate the data, unfortunately.
Okay, the reason why I was asking was just because I believe with the IFG version, or I'm sorry, the American Entitlements version, when you input a client's data and like complete a sale, their information automatically gets input into the CRM.
You should
Perhaps.
see that regardless. I actually, most of the time, use the IFG version just out of habit, and I see that pull into the CRM regardless. So it shouldn't affect that.
Okay, very good. Perfect. Thank you for answering that.
Yeah, no problem.
Hi, Crystal. Sorry, go ahead, Lisa.
I've never used the Medicare on Demand comparison tool.
It's not a comparison tool. Medicare on Demand is on our client websites. You can use it. I utilize it quite frequently when I'm looking for orientations, especially counts and how far booked the room is getting, just so I can see if what we need to do marketing wise, if anything. I pay attention to that, and also to let the person who's doing the orientation to know how many RSVPs there are. Other than that, it is a tool that patients can use on the health. Crystal's really the expert Medicare on Demand, but they can go in and they can put in their stuff just like we do on Sunfire, and they can create their own quote and enroll. And it also has a unique identifier so that if they get hung up, which 9 out of 10 times they do, and they call in the call center, we can get that number. And that way it's bi-directional so that we can see what they're seeing.
I think the only caveat with that is that you as the agent don't get the sell if they complete their enrollment through Medicare on Demand. So you do want to complete the sell through your own Sunfire. But it does, if they go ahead and start it on Medicare on Demand, then you can finish it. You can use the information and finish it in Sunfire.
I guess the point I was trying to make is that it does allow for the client and for us to see what they're looking at so we can describe it for them better, kind of like a Teams call. I think that's the benefit. And then we go ahead and write them in our Sunfire CRM.
I love the bi-directional aspect of it because we can both look at the same information, and because it's specific to the health center, the client hospital. It's only showing what that hospital accepts. So if they don't accept Humana, it's not showing Humana as an option. Or if they don't accept United Healthcare, it's not showing United Healthcare as an option. And so it helps us to narrow down those options for them. And because they can see it as well, I enjoy that part of it. But it's not necessarily
It's not
a
an
comparison
agent tool.
tool. No, not necessarily. But it is something that I use on occasion with my clients, just so that they can see what I see.
Okay. That was all a little bit, yeah, I don't think I've ever visited Medicare on Demand. So,
I did MedicareOnDemand.com, and you can play around on it to kind of see and gather information that we have out on our client websites. Crystal, do you have anything to add about Medicare on Demand?
No, I just wanted to check in.
I'm so glad you're here, actually.
Yeah, if you want to check out your local healthcare provider, it would be MedicareOnDemand.com/Loyola or whoever you're close to. But yeah.
She's in Nebraska.
You're going to have Brian Health out there. And I believe it's Brian Health.
Yeah. And then we also have one, MedicareOnDemand.com/NE.
Yes, a state version. Exactly.
Any other questions that we might be able to answer? This was the quickest training ever. Charlie, we didn't make it last long enough. Did we answer all questions though? Or are there any other questions that maybe we weren't addressing today?
I think you guys did a great job.
Thank you, Kyle. Well, all right. Well, thank you guys for attending. And the next one is about, it's more in depth actually. Let me see. Marketing strategies with the modern touch. And we're going to talk about social media marketing as well. So that one's going to be a lot of fun. And I hope to see you all there in 2 weeks. But have a great rest of your week, and we'll talk soon.
Take care. See ya.
Everyone.
Thank you so much. Take care.